The influx of coronavirus patients into our medical facilities is continuing to overwhelm our healthcare workers. In the last day, another 831 COVID-19 patients have been admitted to hospital for care. Well, joining us now to share her experience of this whole COVID-19 journey is Groote Schuur Hospital's intensive care unit doctor and neurologist, Dr. Christel Arnold. Thank you so much, doctor. As I understand it, you are a neurosurgeon, but you were transferred to high care to help out, as many of the specialists have, at Groote Schuur Hospital when the pandemic became so rife.
Hi, Annika. It's a pleasure to be with you this morning. I'm a qualified neurosurgeon, you're correct. I qualified in 2018, but I'd already known that I was going to go into the field of critical care, and at that point already made a decision that I was going to subspecialize in critical care as a subspecialty field. This decision was obviously made before COVID had hit the world, and it just happened to have been that I ended up in ICU at the time of a world pandemic. So I started my fellowship already in June 2019, and then obviously the following year COVID had hit us. So it's been an extremely interesting and challenging time to be in critical care as a field, but also at the same time a great privilege and honor to be part of the critical care family at Groote Schuur.
Doctor, tell us about life at the moment inside ICU with critically ill COVID-19 patients.
So it's very hard at the moment. It's an extremely busy service. The ICUs, not only at Groote Schuur, but around the world and in our country especially, has been impacted greatly by the COVID pandemic. Our ICU services have expanded by over 300% in terms of our bed capacity. It takes a lot of teamwork and human resources and ventilators and beds and equipment to get that up and running. And we have a tremendous, great team at Groote Schuur Hospital, the critical care team, the management team at Groote Schuur, and every single doctor and allied healthcare professional is really like working around the clock to make things work and to help these patients in the ICU. The patients are critically ill. It's emotionally very hard. Our admission rates every day is staggering. And it's very hard to try and keep the families up to date and to give them information on a daily basis of how their loved ones are doing in ICU. And like I said, it's an incredibly busy service at the moment.
You need a lot of concentration as a doctor and a nurse in ICU. You've got to be watching those stats all the time, especially if people are being ventilated. Those shifts must be pretty exhausting.
They really are, but I must say we've got such a great spirit in the hospital. Everybody has very much a can-do attitude, where if we are faced with a problem on how to expand for more beds and we need to work more hours, nobody is looking for a way out. Everybody stands together and everybody tries to see what plan can we come up to make this work, and just to do the best we can for our patients and fight as hard as we can. So really, everybody carries each other. Our team is tremendous. Everybody tries to give doctors a break, nurses a break. We're all just trying to carry each other through this, and we know that we are fighting for our patients, and it makes it a lot easier to do. So the long working hours kind of is part of day-to-day life, but we know what we're working for, and we try our best for our patients and their families.
You've been through the first wave, the second wave, we're now in the third wave with the Delta variant. Are you seeing patients presenting different symptoms to alpha and beta, for instance?
I think for all of our waves that we've been through, we've experienced some difference. Our first wave, we were quite shocked and to learn how ill these patients can really be. We've seen oxygenation levels drop to lower than we ever thought was possible to see in a patient and survive. So the first wave was very, very different and something new that we needed to get used to. And the second wave, again, we saw patients presenting differently, and we had to get used to a different way of treating patients again. And I think it's safe to say that the third wave, we're seeing something different again. So what we've learned in the second and the first wave, we're carrying through to the third wave, but it seems like we're always caught with new surprises that we need to adapt to just manage our patients as best we can.
Last question, Doctor. How are you dealing with patients' relatives? I presume many of them are prone or they're ventilated. Are their relatives phoning you? Are nurses trying to make cell phone calls using their own telephones? How's that interplay working? Because that puts an extra pressure on staff.
Absolutely. I think it's probably, apart from the medical management of these patients, which are very tricky, each patient kind of reacts to therapies in their own way, but the emotional burden of, trying to explain to families that their loved one may not be doing so well. And even though we can't predict an outcome, we generally have a good gut feel of which way this patient is going, whether or not they're responding to therapy or not. And to counsel families over the phone is an enormous emotional burden. We have a great hospital management team, though, so we have a lot of support from our psychology and psychiatric services that not only helps us with counseling families, especially if the family member in the ICU is not doing so well, but also to support the doctors and the nursing staff working in the ICU, which has been a tremendous help. It's been a very heavy burden for doctors to carry. These patients are sick often for weeks and weeks at a time, and to fight for a patient so hard in the end just to maybe not have the desired outcome is really a hard knock on everybody in the team working together.
Doctor, when you see a patient passing away, this is quite a personal question, but when you see a patient passing away, one that you fought so hard for, what do? Do you just say a little prayer for them? Do you say your own little goodbye?
Yeah, so on a personal note, I usually do take things emotionally quite hard and tough, and you just try and find a corridor in the hospital, just a moment to be alone, and I usually have a tear or two. And we do, our hospital policies also to try and bring family members in. We usually try and bring at least 2 family members in to be able to say their last goodbyes if we know that the time has come. But it's often very hard for me, and I often cry with the families when that time arrives. But yeah, you say a little prayer and you wish that things could have gone differently, and you kind of wipe your tears away and you walk back into the ICU and you fight for the next patient.
Dr. Christel Arnold, a neurosurgeon at Groote Schuur Hospital working in high care. I would feel so safe in your compassionate hands. Thank you so much for joining us for that story there.